It's not all. Again, RSV cases are going up everywhere now that schools are in the swing of things.
All right, so Fox 13's Maria Garcia joining us in studio this morning. Maria, hospitals nationwide are calling this an emergency right now.
Yes, because it can be so scary, especially depending on the age of the child. So RSV, again, is a respiratory virus, and cases actually fell quite a bit during the pandemic. But of course, schools, daycares, and businesses had shut down, and masks were helping stop the spread when people were together. But now that restrictions are relaxed, doctors warn that there is going to be a rise in cases that is coming fast. So the common complaint with RSV is a runny nose, cough, fever, but then there's also wheezing and rapid breathing. As for how it spreads, most children, it's contagious for about 8 days, but for babies, it can spread for about 4 weeks. Most kids in the U.S. get it by the time they're 2 years old, but of course, the pandemic delaying that, and some highly vulnerable children were isolated a lot from other illnesses. Officials say RSV generally leads to 58,000 hospitalizations and up to 500 deaths in kids younger than 5 every year. And there is no specific treatment either, but there is an antibody-based medicine for premature and vulnerable babies. According to experts, serious cases could call for hospitalization, including use of oxygen or even a ventilator. Doctors say that the surge arrived earlier this year than normal, with more than 7,000 tests coming back positive just last week. That's according to the CDC.
In young babies or kids who have heart and lung problems or perhaps were born prematurely, RSV can have some serious symptoms and is also a common cause of hospitalization in babies throughout the winter months.
So doctors at Seattle Children's Hospital say that if you are worried about your child having severe breathing problems, do not hesitate. Go to the ER, call 911, because if it is RSV, it is on the rise in Seattle. For less severe illnesses, you can call your doctor, your regular doctor, and get advice or go to the urgent care. The CDC says it is hard to track these cases because hospitals don't actually have to report them, but doctors do encourage everyone to use good hygiene, stay home if they're sick, and make sure they are vaccinated against the flu and COVID-19 to try to prevent any significant strains from hitting hospitals. Here in the studio, Maria Garcia. Back to you guys.